We're going to spend just about 10 minutes getting to know you a little more. I'm curious first, when you're at receptions with people like this and you're among smart peers and colleagues and people are being honest and authentic, how do you answer the question of what are you spending your mental energy on? What are the things that are commanding your attention at work today?
Well, good evening, everybody. Thank you for joining us. I'm always anxious to see progress as fast as possible. I was just saying this to people that I probably can be a pain in the ass because I'm really anxious to see progress. And that means in all aspects of what we as a health plan and what we as a community health center-based provider can do. And there's just so much we can do to improve people's health. It's inclusive of being more actively involved in social determinants of health. It means improving our quality, closing gaps in preventive care issues and doing what we can around quality performance. It means involving our folks in care management and care coordination and working with our provider community in having that holistic, integrated care approach. So I'm always anxious in terms of we can do more every year, and we do that, and it's working in a collective manner with all of the stakeholders across the state.
So you joined CHPW from Massachusetts, where you were prior to Washington State. Came in. Now we find ourselves in the middle of this waiver. You've been here a few years now, obviously, but find ourselves in the middle of this waiver. We're in year 4 of this 1115 waiver. It's a unique kind of waiver in America, really. Funds things like supportive housing, supportive employment. We have in statute accountable communities of health. We've gotten statute behavioral health integration. I'm going to ask you for your candor about what's not working. First, I'm going to give you the easy one. What is unique about what is working in this waiver environment now that we're in year 4 of 5 that we want to try and keep around moving forward?
Right. Is it really year 4 already?
It is today.
Oh my
yeah.
God, time goes by too fast. No, I think what's wonderful, and one of the reasons that I came to the state of Washington from Massachusetts, which was a very progressive state in the healthcare area, is that Washington has recognized the importance of that multi-stakeholder collaborative model and the need to work with organizations that are not traditional clinical medical organizations. The integration of behavioral health and medical care is at the core of a lot of the work that is under the waiver and what we've been doing at Community Health Plan of Washington. It's been core to the model of care that CHNW, CHCs have been involved in. But beyond that, it's working among stakeholders that include criminal justice systems, schools, housing, transportation, the full gamut of services that impact people's health. And that's really the strongest aspect of what this waiver has enabled us to do.
So this engagement with community around community and population and individual health.
Absolutely.
But what are we still falling short on in Washington State healthcare from where you sit?
Well, I just think it takes time. And it takes a certain degree of coordination and leadership. I think we're getting there, but it takes time. And I think the model is a good one, and it's not that we're falling short in terms of what the principles are or the goals or the even the structure to get there. It's just that it takes time. It takes a recognition of ability to harness the skills and the talent in a coordinated fashion, and I think we're on the right track. I really do.
So a lot of people know that CHPW, Community Health Plan of Washington, is one of the 5 managed care organizations in Medicaid. You mentioned Community Health Network of Washington. Not everybody knows what that is. And you've mentioned CHCs. Explain the relationship between the plan, the network, and the providers.
Yeah, no, I'd love to. So Community Health Network of Washington is our governing body of the health plan. And it's been around for 25 years. It's made up of 20 community health centers across the state. Community health centers in the state of Washington are really amazing provider organizations. They've been around they've been at the forefront of a model of care that integrates the patient needs in a very holistic way. And that's, we all talk about that, but community health centers have been doing this work long before anybody else has been doing it. They're all patient-centered medical homes. They all have services that are team-based and include, language support and transportation and homeless security, housing security support and community health workers. And their very model has been a very integrated model long before we talk about that in the private sector. And the reason I think that they've been successful in this regard is that they have not had the advantages of money just flowing in. So they've had to be creative and they've had to be innovative. And it makes for a wonderful model that we all can learn from. And Community Health Plan of Washington has been the child, so to speak, of this network of community health centers. And we've been around for 25 years. Started as a health plan to serve people that had not been well served by the traditional insurance market.
Came out of that 1990s Washington State reform effort.
That's right.
It was complicated then. It turns out it's still complicated now.
Right.
Tell us, this public option, you talked about creativity and innovation. This public option conversation included a lot of creativity and innovation in the legislative session, in the rulemaking and creation after the fact, and in the procurement, which is coming. CHPW was vocal in its support early, concerned early, but ultimately supportive early. Do you think the public option model in Washington State is going to be very innovative and very consequential, or is it a modest step forward?
I think we all have very high ambitions for the public option. And when we first supported it, we supported it at the very early stages when it was about a particularly ambitious set of characteristics, including 100% of Medicare for the provider cap. And it was really, a bit radical from a lot of people's perspectives. We ultimately continue to support it at a more modest design, recognizing that it's a good step forward. It's not going to change the world in its current design, but it will be helpful, hopefully, to include people who have not currently been able to afford coverage on the exchange or on the individual market, people who are caught in that gap between group coverage, employer coverage, and Medicaid, and where the individual market is just not meeting their needs. So it's a step in the right direction.
So my own view, and I'll ask you to respond to it, is that with all the talk around Medicare for all, that there's this, it has made reimbursement caps or increased indexing far more centrist because Medicare for all has moved the conversation to the left. Yeah. And that whether the public option in Washington State is significantly consequential to the market or not, I don't know yet. But it seems like a really big deal that the legislature has just affirmed that it's okay to dictate caps for provider reimbursement in the marketplace. And today it's on the public option, and tomorrow it could be another line of business. Is that where we are? Is that a centrist response that the legislative bodies should be dictating price reimbursement because otherwise controlling costs is just not proven to be effective absent legislative action?
Well, I think ultimately we need a combination of public programs that have reimbursement caps and a private market that, the market dictates what that reimbursement level is. There has been successful reimbursement caps in the state of Maryland, for example, that has been working with hospitals. So that is a model that can work as well. But I do believe that, today as a reality, Cascade Care isn't the first time we're seeing reimbursement caps. Medicaid has, in effect, reimbursement caps because if you don't participate in Medicaid and a member of a Medicaid health plan, a Medicaid-eligible individual gets services, the reimbursement is still limited to Medicaid reimbursement. So this state has taken that step before in Medicaid. And Medicare, of course, is another example of that. So there are, you know, this is how the patchwork of this country's healthcare. There's a combination of public, which has reimbursement limits, and commercial. So I don't see this as radical by having a public option for this limited sector that doesn't have healthcare options otherwise.
So you mentioned, this will be my last question, I'll let you get back to networking with folks. This time goes by really quickly. Who knew? So you were involved early in the public option legislation. You've been very active since you've been here, far more active, I think, than CHPW has been prior to your arrival in the last, considerable amount of time in the legislative process, trying to drive reforms there. What are we going to see? What does CHPW's legislative agenda look like for 2020 and maybe future years? What are we going to see on the horizon, because CHPW and its clinics have been advocating effectively for them in Olympia?
Well, we see ourselves as providing a very important voice for the low-income individuals in the state of Washington. And so wherever low-income individuals have issues associated with healthcare, that's our role, to play a voice, to be their voice. And it also includes people that may be in communities, immigrant communities, for example. That is a big part of the sector that we serve. So at the end of the day, it's all about the safety net, making sure that people have coverage who need coverage. Hopefully the federal government will continue to do their part. And also recognizing all the issues that relate to people who are marginalized and underserved. That's wherever those issues are, that's where we will have a strong voice.
My own view again, I'll just say that for us to collectively figure out health reform, we need some organizations and organizational leadership that is willing to be courageous and take risks. I appreciate that CHPW is courageous and willing to take risks. Thank you for your leadership. Let's give Leanne Berge a round of applause.